to the show. Our three questions that
with Sugar Fix in Chicago with Dr. Jessica Emery. So thank you so much for jumping on.
I mean, I'm still gonna work on it, but
then right away, as soon as that first thing comes out, they sign up for
it. I'm your host, Allie, and I have here with me Dr. Kate McCann. And she is here with us today, and I'm excited for everyone to meet her. She is the owner of Aurora Modern Dentistry in Colorado. And Dr. McCann Lee has a huge passion for mentoring dentists, and she's really amazing at helping new dentists onboard into the dentistry practice and leading women in the dentistry industry. And she has a big passion for it and really loves helping her patients. So she's offered two amazing programs to help develop new grad students and developing women into leaders. So also, she's one of the most amazing dentists. I've heard some great things on how you've been helping mentor your new women into dentistry. And I also want to congratulate you on being the 30 under 30 in 2019.
thank you.
You're welcome. So if you would like to really explain to us maybe a little bit more about your dental practice and what kind of got you started into dentistry and what was really your passion to get started.
Sure, absolutely. So when I was 14, getting ready to go into high school, I was involved in a four-wheeler accident that broke all of the bones from my eyebrows down. And it took 4 years and 9 reconstructive surgeries to rehabilitate my face and then also restore my jaw function. And through that whole process, I lost several teeth. And even though I was going through surgeries, it wasn't until my dentist finally restored my smile my senior year of high school that I said, this is something that I want to be able to do for other people, because I was able to experience firsthand what it's like to not have front teeth and not have the smile that you want. So from there, I decided to enter dentistry, and I graduated from the University of Illinois at Chicago in May 2010. And then ever since then, I've been working in Colorado, and I've been able to expand my offices. I have one main office that you spoke about, Aurora Modern Dentistry, but I also am a partner in 82 other dental practices around the country.
That is amazing. I mean, wow. I just think, your smile is just so beautiful. And that story, I am so sorry you had to go through all that, that horrible accident. And that must have just been really a good motivator. And honestly, it's so touching to hear that story and how you wanted to change more people's lives and like how you dealt with that pain and the struggle of probably having to deal with that and really just like overcoming it and doing more. And I really congratulate you on a menu for that. That is a beautiful story.
Thank you.
You're welcome. And it's just amazing to me too, like that you said you had to restruct so many bones. I mean, your face looks just so beautifully, and your smile, whoever helped you with your smile, really good job.
Thank you.
Yes. I wanted to bring up how technology is, I saw a lot with your practice and things, and throughout your social medias, you do a lot with it. And I know it's very prompt, and it's, moving forward and moving fast, and technology is incorporated more than ever in the dental practices. And I'd kind of love for you to share with me maybe like your Diamond in the Rough products. This would be something you're using in your offices or at different practices that not many people know about, but it's been a big advantage to you.
Sure. So the one technology that I've integrated that's kind of in a diamond in a rough is the OralDNA salivary testing. So I'm a big proponent of whole body health. I live in Colorado, so we tend to focus on, whole body health, wellness, things like that. And I've incorporated the OralDNA saliva testing to help my patients understand the connection between oral inflammation and systemic health. So we have the ability to test our patients for periodontal pathogens, to tell us the risk factors for periodontal disease as well as systemic conditions. And we've been able to use that for a lot of different reasons. The main reason why I love this technology is because it's actually educated my providers on how serious the periodontal inflammation actually is. A lot of providers, when they come out, they may be a little bit lax in terms of when they choose to diagnose periodontal disease or when they choose to treat it. But this technology has really proven to them that the 4 millimeter pocket with bone loss is just as serious as the 6 millimeter pocket with bone loss. We just haven't had that much damage yet. So it's really shifted the mindset with my providers on being more proactive healthcare providers versus a reactive healthcare provider. So we're able to identify the patients sooner, we're able to treat them sooner and get better results. So it's really been fantastic. It's also really helped our patients understand what we're trying to do as well. You know, we have a lot of patients that come in that say, oh, my gums have always bled. That's just how I've been my whole life. You know, with this technology, we can say, well, they've always bled because of this, whether it's bacteria or whether it's an inflammatory marker gene that they may have a mutation in. It's really helped us explain to our patients that that's not normal and that we can get them back on the path to greater health.
I think that is so wonderful. I never even heard like this. Like, I know like people are like integrating this more into their practices, but like, I think that's just really great. Like, so it's a lot of wide range on patients, correct? So like you're saying you can catch it a lot sooner, or you're actually understanding, like you said, that whole body, like what's the initial cause. And that's like with the oral health issue, correct?
Exactly. And then once we get that report back, it'll tell us what the bacteria is that will affect systemic conditions. So then we can work with the patient's healthcare provider on how to manage their heart disease better, how to manage cholesterol, how to manage their diabetes.
That is so amazing.
Arthritis or something like that that we need to help control. So it's really been wonderful.
Yeah, it seems really like all inclusive of figuring out like the main, you know, like pain point or problem that's going on. And then you guys can really, even not only with the mouth, but can get that long-term on their health. So, and figure out that problem. So that's amazing. You've been doing that. How long you've been, is that just something you started, or is that something you've been just recently implementing?
So we've been doing that for about 5 years now. So quite a long time.
That's great.
We really honed in on it and took off, I would say probably about 3 years ago.
Okay.
And now it's an integrated part of our practice. So my hygienists are the ones that kind of run with it now, because they're very well educated, and they're the ones that are managing the patient's perio condition over time. So we've really given it to them to empower them as healthcare providers, not just hygienists, into making our patients healthier.
That is like outstanding. I love that the results, like you're saying, like they have that knowledge. I mean, I think it's really great to maybe help them really feel more like empowered and have more knowledge, really help their patient. And it really has to be all like also a whole body feeling to be able to help somebody make themselves feel so great about their, not only oral health, but like their health that's going on without their body, throughout their whole body. So that's really great. Well, thank you for sharing. And when you got started, how did you first implement that into your practice for maybe dentists that are wanting to think about starting doing that in their practice?
Yeah, so I think that the first thing is figuring out how to communicate it with your patients. So when you start talking about oral DNA testing, it can kind of sound cumbersome and overwhelming. And so we just try to simplify it and say, hey, you have an infection going on in your mouth. We would like to know what the bacteria is that's causing the infection, how it's affecting your systemic health, and how we can best manage you. So that's how we explain it. And then once we got into that with patients, it was much easier to communicate the benefit, and they all saw it. I think the other big thing to jumping into it is you just have to jump in with both feet, right? So some of my docs that I have coached along the way, they'll sprinkle it in a little bit, like a little bit here. Maybe I'll try it with this patient. With me, it's more like we're all in or we're not in at all. So we give it to every patient that we diagnose with gum infection. And by jumping completely in, we've been able to see great results.
That is great. I'm happy to hear that everything's been really running smooth with that, because I mean, a lot of dentists, like you're saying, like you're actually getting more of that side of actually diagnosing and being more like help with the health of their patient. And I just think that's astonishing. Like you're saying, those results, like that has got to be so neat. Like then it's like, I go to the dentist and I think that'd be something that'd be helpful for people who do have the disease and need to really find out the first cause of that problem.
Right, for sure. Because not everybody is treated equally, right? Like,
no, they're definitely not.
Yeah, you could have different bacteria. You want to do the appropriate treatment for the bacteria that's there. And then today, my office actually just had a company from Germany come in, and we're going to start testing one of their products, which is a litmus paper test, if you will. Where we stick it into the sulcus of the gum tissue and actually see if they have current periodontal breakdown. So that'll tell us, help us understand at what phase they're experiencing periodontal breakdown and how it's affecting their whole health. So we're excited to try that, but just started today. So I'll let you know how that turns out.
Yeah, that'd be great to bring you back on and kind of hear how that trial went. That'd be amazing, because I think a lot of dentists would like to learn more into this and how to help better care for that patient issue. Because I know it's definitely a thing and it needs to be definitely well taken care of. And sometimes you're hesitant on learning it, and it's actually, I think, got to be so beneficial to the practice.
For sure.
I just wanted to hear again, what was the first thing for our first testing? What was the name you like to use to do that for your hygienists?
Sure. So it's called OralDNA.
OralDNA, perfect. Yeah.
So it's OralDNA Laboratories. You can look it up online. The actual test, there's 2 tests that they offer. It's either MyPeriopath, which gives you the bacterial breakdown and what bacteria affect what organ systems. And then the other one that they do is called the Alert2 test, and that lets you know the genetic profile of the patient if they have a mutation that predisposes them to inflammatory processes in the body.
Well, thank you for better explaining that, because I definitely want to make sure our listeners today could kind of learn more if they want to implement that into their practice. So I really appreciate that so much. And I'm really excited to hear maybe your no risk, no reward. So this is our second question. And we really like to know, what was something you went into a dentistry that you bought that was actually really good and a good time investment of money?
Yeah, so there's actually 2 technologies that I really like in addition to the OralDNA technology. And the first one that I want to talk about is the use of CAD/CAM or intraoral scanning. So I'm a big believer in CAD/CAM, and the reason I like it is for a bunch of different reasons. Number one, it makes me a better dentist because, you know, we all wear loupes, which are 3.5 times optics or times zoom. But when you blow it up on a CAD/CAM, you're seeing, you know, 30x of what your prep actually looks like. So it makes you a much better dentist. The other reason why I like CAD/CAM is because it reduces the number of times that patients have to come to the office. And I've seen this most valuable during the COVID pandemic because people were really afraid to come into the office. And especially those high-risk patients coming back and forth for multiple appointments, that's not so good for their health. So with CAD/CAM, we're able to deliver same-day restorations for the most part to our patients when they come in. The other thing is that it allows me to provide better quality restorations. You know, oftentimes when you don't have a 3D imaging unit, you're choosing between a direct restoration and or crown, right? It's one or the other. With CAD/CAM, it allows me to provide these intermediary restorations where I can do inlays and onlays, which are better long-term solutions for a patient, and I can deliver them same day. So that's been wonderful. The other thing that I really love that I've invested in is CBCT technology. We use that on almost every single new patient, and the amount of dentistry that I've been able to see, or infection, pathology, whatever you want to say, off of the CBCT has been astounding. You know, I had a case just last week where I had a patient come in for an exam. We did regular x-rays on her. Her front tooth had a root canal from a couple years ago and from trauma, and everything looked great on the x-ray. And then when we took a CT, she had a massive infection that had blown through the palatal plate that we would have never been able to see without CT. So I also feel like CT makes me a better dentist, a better diagnostician, and is better to communicate with patients.
I absolutely agree with you on all those points. I think the CBCTs are just a wonderful product for you guys. It really blows everything out, magnifies it, and you guys can really get in there and see the nooks and crannies, like, of everything, like you're explaining. Like, it's wild to me how you say, like, an x-ray, you get the, like, you know, you get the clear view, but then you take that image and you just really see what's going on.
For sure.
So I think, how often do you, with your patients, like when you're saying you're seeing like these major like infections, like, I think, is that like the biggest reason a lot of dentists like to go in and I think get this piece of technology?
Yeah, you know, a lot of dentists like to do the technology so that they can plan dental implants, which that's great. I mean, we're an implant office. I do implants, all my associates do implants, and it definitely is beneficial for planning that. But I think the area that's overlooked is actually just in diagnosing. You know, often patients come in, we're diagnosing based off of symptoms, not actually objective findings with test results. And so the CBCT is awesome because it eliminates a lot of the guesswork that we're doing just based off of symptoms. You know, now we can actually see what's going on.
Yeah, I think that's really great explanation of it, because I think a lot of dentists, like you said, you're not using it for, you know, the diagnoses. And I think it's most clear to use it for that. And I'm really glad that, you know, a lot of dentists are doing this. So this is good to hear. It's all great concises. So I also wanted to just touch on which particular CBCT you're using in your practice.
Yeah, so I use the Sirona SL version.
Okay.
I really, really like it. My husband has the Cavo unit. So I think any unit you use is going to be fine, just as long as you know how to use it and properly use the software. The reason why I like the Sirona unit is because we do a lot of sleep medicine as well. And so I'm just really familiar with the Sirona unit and how to segment the airway and go over those findings with the patient. So that's why I choose to use that one.
You got to use what you're most comfortable with. I always say, you know, if that's what you think it's going to integrate best with you and you already know how to train your staff, that is the go-to thing to do. Well, great. And I want to also just wondered if what 3D scanner if you're implementing in your practice and using.
Yeah, so we just, the only scanner we have is the CAD CAM unit. So we use that
Okay.
for our in-office restorations. We use it
Great.
for our emailing to laboratories. We use it for sleep appliances. We kind of use it for everything.
Well, perfect. That's good to hear. And this also brings me to my point I wanted to ask was the flop. And this is kind of any product you're using in your practice that may not have been a big win, you know, it was maybe a little bit of waste of time and money, but I just would love to hear your opinion on this.
Sure. So I actually didn't end up buying this product, but I was testing it. And, I hope I don't offend anyone when I say this, but the product that I had really high hopes for that didn't actually pan out was going to be the X-Guide implant robot, if you will, from Nobel Biocare.
Okay.
I teach implants with Nobel Biocare. I love them. They're my company. We do a lot of guided surgery courses with them. And so when the X-Guide came out, I was really excited because the problem with guided surgery is that you can't do it same day. And my practice is very centered around same day delivery of patient care. I don't want people to have to come back and forth for procedures. And so when X-Guide came out, I was thinking, oh, this is going to be great. This is going to solve the problem for guided surgery. I can deliver same day guided implants in the practice. And when I got the X-Guide, it definitely didn't pan out that way. I think they'll get there someday, but some of the problems that we had was that the machine had to be ported into an internet connection in the wall, not wireless, so it can only stay stationary in one operatory. Now I have 11 operatories in my practice, and I probably run 5 of them at one time. So I don't ever have like one operatory reserved for implant surgeries only. I need to make sure that the unit is mobile to meet me where my patient is. The other thing is that the time preparation to plan the surgery and to get it going was really, really long. You had to take impressions with clips and x-rays and import CBCTs and merge them, and it just got to be really, really complicated. That coupled with the fact that you had to heat up the clips before you could take the impression with like a hot water bath. I mean, it just was really cumbersome. So while the idea is great to deliver same-day guided surgery, the processes that it takes to be able to do that were just a little bit clunky at the time. So I'm hoping that they'll come out and better the technology in the future, because I would certainly love to try it again.
Yeah, I think that was like so interesting how you explained, like, it wasn't as mobile. So it's really like more of an efficiency thing for sure. And I totally understand, like you said, you got so much going on. It needs to be able to be moved room to room. And
Yes.
It's hard when it's stationary. It doesn't make that quite easy to keep the flow of the day working. So I completely agree that if they could get that system a little more efficient and not have, like you said, where it's not as it has to be portable.
Yeah, it has to be portable,
Yes.
it has to be wireless. The setup has to be seamless, not all this back and forth between CT and x-ray and imaging and merging file. I mean, it was just like too much.
Sounds like a lot of steps. And then, the idea too of just stationary, that's gotta be difficult when you're trying to run all your ops, like you're saying. So yeah, well, thank you for explaining your flop to us. And I wanted to also just touch on when you're doing your patient care I call it the dental fluence. So when you meet your patients, I can already see that you're so great about making like this peer relationship with people. You're so great about connecting and making a community. And I feel that when I was looking through all of your stuff on even like a couple of your lectures and things and reading your 30 under 30, and I was super interested just to kind of hear how when you do your connections, when you're doing like say your patient care to wrap up and you do before you want to do your diagnostic process, just kind of walk me through how you talk to your patient and probably maybe explain to them how you want to use a certain technology.
Sure. So I think the biggest difference between my office and maybe some others that are out there is that we do what's called a new patient interview. So before the patient ever goes into x-rays and diagnostics and CBCT, I meet with the patient first and I ask them a series of questions during the new patient interview. Because what I want to know is, what is the patient after? What are their goals? What do they not want to have happen? What are their past experiences? Because I want to make sure that whatever I'm delivering for them in terms of care meets with their goals. I don't want to just dump a treatment plan on anyone if that's not what they're wanting. So I try and align my delivery of care with their expectations. So I think that that's really important. And then from there, I can use technology to meet those expectations that they have.
Yeah, I think that's such a great, interesting idea. Like, just like you said, like you get to do a new patient interview. So right before you go and do anything, you know, you kind of get to build that common ground and relationship and really figure out what their goals are. And I think of course you're going to do a wonderful job meeting them. You have such great care plans, and I would just assume, you know, getting just to meet you here today, you've just been so welcoming, and I really appreciate that. So yeah, and the dental fluence for that is really, I guess, like you said, kind of getting that face-to-face experience first before you really jump into the dentistry and diagnosing them and using the new technology. To kind of maybe get to step-by-step explain before they even go into it what they'll be having to do or what you'll be treating.
Exactly. I think the point that we all need to remember as dentists is that we're here to serve our patients, not the other way around. So if we can keep that in the forefront of our mind, I think we'll all be successful.
Yeah, I agree completely. I think that's definitely the big thing, is making sure you and your patient are comfortable working together and building a good repertoire and making sure they feel most comfortable at your practice. And that makes a good, smooth transition into treatments.
For sure.
Well, thank you so much for being on here with us today. I was so glad to have you on Dental Tech Chat. Thanks for sharing all of your advice on what you've been using in your practice, and we wish you well. And thank you for being on again, Dr. Kate.
Thank you so much for having me. It was a pleasure.
It was so wonderful having Dr. Kate McCann Lee on our podcast today. She is the owner of the Aurora Modern Dentistry in Colorado. If you'd like to go visit her, as you heard her story here, she loves taking care of her patients, and she goes above and beyond in providing the most efficient diagnostic tools in dentistry with technology to implement the best care for her patients. She also does a really great job of giving her patients an interview before you guys even go into diagnostic treatment. You can also follow Dr. Kate McCann Lee on her handle on Instagram to follow her story and how she helps mentor dentists and women in dentistry as well. It was so wonderful having her on today, and we'll see you guys in our next video. Bye, guys.